Welcome to Geological's mini-series dedicated to sports and orthopedic acupuncture. For the next few days, I'll be bringing you several podcasts a day from the Sports Acupuncture Alliance's conference in San Jose, California. In addition to interviews and discussions with speakers of the conference, you'll also be hearing from participants, and you'll have a special front row seat at a roundtable conversation around the issues of running a sports medicine practice. The Sports Acupuncture Alliance was created to promote the study and practice of sports and orthopedic acupuncture. I'm delighted that they were willing to partner with Geological to bring you this mini-series so that those of you who were not able to attend the conference could learn from the speakers as well as the participants and to get a taste of what it's like to be here at this special event. Please enjoy these discussions and take what you learn here and use it in your clinic. These conversations come to you through the generous support of our sponsors and members. All the sponsors here provide helpful products or services that you'll find beneficial in your clinical work. Want to get better at treating concussions and other neurological conditions? Clayton Shoe has some innovative methods. Blue Poppy, your new one-stop shop, has speedy shipping options on everything that you need for your clinic. Later in the show, Jane offers you helpful suggestions on how to raise your rates, and Golden Flower Chinese Herbs shares a journey of healing that I think you'll recognize. Do be sure to visit the sponsors page on the Geological website to take advantage of all the special offers our terrific sponsors have for listeners of the podcast. Picture this. Your clinic is buzzing with patients, and then you realize that you're down to your last box of needles. No need for panic, because Blue Poppy, your one-stop shop for all your acupuncture needs, they ship orders received before 3 p.m. on the same day. With a quick visit to Blue Poppy's website, you can order premium needles, herbal formulas, and that special Dr. Bob's oil that your patients love. Blue Poppy understands practitioners can't keep patients waiting. That's why they strive to get you what you need when you need it. From high-quality Chinese herbs and formulations to acupuncture supplies and clinical essentials, Blue Poppy has served practitioners for nearly 40 years with products that meet the highest of standards. Discover everything Blue Poppy has to offer by visiting www.bluepoppy.com, and don't forget to subscribe to their mailing list for exclusive offers and more. Ever found yourself listening to a geological conversation and thinking, wow, I needed to hear that? Yeah, me too. And I never know when I'm going to hear a guest say something that stops my world and reboots it with a larger perspective. If these conversations have ever helped you to feel more grounded, more inspired, or just less alone in this strange and wonderful work we do, consider becoming a member or supporting the podcast with a bit of tithing to the donation jar. It helps keep the lights on here at the Geological Sound and Motion Lab so that we can bring you these conversations every Tuesday morning. You'll find all the details at geological.com. Thanks for listening and for being a part of this.
Hey there, I'm Cameron Jafari, an acupuncturist from Los Angeles. So I started learning nanopuncture from Dr. Clayton Shoe because I was facing these complex neurological conditions like stroke and MS in my clinic, and I just felt like I lacked a solid process to treat them. Brain-related issues always felt like a whole different animal, and I was looking for a clinical system that worked and could guide me through them. So after attending my first nanopuncture seminar, I was able to apply the process pretty quickly and with pretty amazing results. I remember the first stroke patient I saw afterwards was a guy who had had a stroke 2 years back, and he couldn't talk at all. And after a few treatments, he started saying a few words. And a few treatments after that, he could actually have conversations. It was pretty incredible. So this is why I feel like nanopuncture is the future of acupuncture neurology. And you can be a part of that. Their next seminar is on treating concussions and is being co-taught by both Dr. Shoe and Dr. Ayla Wolf in New York City on April 26th and 27th. To learn more, visit nanopunctureseminars.com.
Anthony Vandermaal, welcome to Geological.
Thank you very much. Great to be here.
This has really been fun here at the Sports Acupuncture Alliance's conference. And I'm so delighted to have an opportunity to speak with the different speakers, and delighted that we could find a little bit of time here to have this conversation. I'd like to start with how you found your way into doing orthopedic and sports acupuncture. Is this a long-term interest of yours, or was there some sort of inciting incident? What set you down this path?
Sure, that's a good question. My own injuries. When I was 24, I had a bad bike accident that left me with a lot of neck pain and a concussion. And then later that same year, a soccer injury where I tore up the muscles on the inside of my leg, affected my gait and my spine. And conventional physical therapy didn't really seem to help me very much. And what worked best actually was Tai Chi. And that really piqued my interest and I was living in San Francisco at the time, so it was very easy to branch out from there into acupuncture and Chinese herbs and Chinese medicine generally. And so I was kind of on the fence. I was interested in physical therapy, even though it hadn't worked well for me personally. But when I really had to make a decision, wanted to make a decision about going into a career that would last for me, Chinese medicine seemed like a much bigger field with a much broader scope and had worked better for me. So that was the logical choice for me. But I always maintained an interest and a focus on orthopedics and sports injuries and neuromuscular skeletal pain, because that's how I found my way to it in the first place.
Yeah. And it sounds like you had a long-term interest just in how the body works. I mean, you sound like an athlete.
A wannabe athlete, let's put it that way. Or I would have been athlete. But I enjoy using my physical body, sure. And I've been more of a dabbler in everything from rock climbing and backpacking to racquetball and not great at anything, but enjoy all of it. Surfing, what used to be called rollerblading, inline skating. So I think that's a lot of how I've learned, is from trying out different activities, Tai Chi, Bagua, martial arts, and finding out and feeling, what do they do to my body, and do they help? Do they hurt? Is yoga helpful? Is Pilates harmful, etc.? Just experimenting and learning from my own injuries. And really, I feel like that's the best way of all to learn.
Yeah. Well, it also sounds, some of us are very visual, some are auditory, and some of us are really kinesthetic. And it sounds to me like you might be one of these kinesthetic characters. You kind of make sense of the world through your body. Would that be an accurate way of?
Yeah, certainly it does make sense. And I'm not much of a learner. Herbs have never really done that much for me, which is a puzzle and a frustration to some of my colleagues, but I can't really feel their effects in my own body very much. And that makes me very unsure and hesitant when prescribing them to patients. And physical modality is exactly the opposite. I feel acupuncture's effects. I like how it feels. Gua sha, cupping, tui na, exercise, therapy fascinate me because I feel their effects in my body, and I want to share that with other people.
That's great. To be able to have a way of sensing and knowing what you're sensing and making, being able to see what works, what doesn't, being able to feel it on the inside. I suspect I know it's important, in my practice to, have to be able to feel it yourself, so that you got a sense of what the patient is.
Yes, and it makes it much easier for me to look the patient in the eye and say to them honestly, I have a sense of what's going on for you. I've been there myself, where I feel that. I know what it feels like to have a needle go into that area. I know what it feels like to have a pain in that joint, and that increases trust on the part of the patient, and empathy, I think, is very helpful for the therapeutic alliance, if you will, and improves outcomes.
Yeah. From your experience, how would you say orthopedic acupuncture differs from, I'm just going to say, regular, what we learn in school acupuncture?
Oh, that's a good question too. I don't know that it does. I think my own sense is, now I have not been to China. I have not studied in China. I'll be upfront about that. But I wonder whether what we get taught in schools in America is really an accurate, complete representation of acupuncture and Chinese medicine the way it's been practiced historically in China. I think there's a lot of indications that it's not, that we get kind of a distilled Reader's Digest, compressed and distorted version, and then we twist it further because of our own inevitable cultural lenses and biases in the West. But then I look at videos. I mean, YouTube is now a great resource, and I see acupuncturists in the Far East using enormous needles, going deeply into the body in large numbers in ways and then I see the comments on Facebook from Western practitioners who are horrified, shocked, wringing their hands. It looks like surgery. It looks like barbaric, etc. But that's Eastern medicine. Eastern medicine is diverse. Just as Western medicine is diverse, and we've got everything from the subtleties of homeopathy to radical orthopedic surgery. It's all Western medicine. Same thing in the East. So I have good reason to believe, based on historical sources from teachers that I've studied with who have spent a lot of time in China, that some of the kinds of kneeling techniques that are now taught in the West as orthopedic acupuncture also have roots or parallels in the Far East.
Well, I know I've spent a little time in Asia and some time in acupuncture clinics, and I know that what I saw, sometimes it was very similar to what we do, and sometimes it was really different. And my basic takeaway was, I don't think I can get away with that in the United States.
Yes.
So there is that.
Yeah. Yes.
So it sounds like you're doing a lot more deep needling and maybe with more stimulation. Is that a correct characterization?
I think that's compared to the way acupuncture is generally taught in most schools in the West, I'd say yes. But like I say, I don't know that it's actually any different from how acupuncturists in the Far East would treat orthopedic injuries. And again, we've got everything from the subtle off-body needling of Japanese practitioners to the deep needling with needles the size of, knitting needles, or even I've seen things that look like a golf club going into somebody's back from a Korean practitioner, right along the spine. And so I think I'm not sure I really answered your question, though. I think your question was, how is what acupuncture orthopedics different from what's taught in school? I can't speak generally to acupuncture orthopedics, but I can talk a little bit about what I do and what I've learned to do from teachers. So
yes, that's exactly what we're looking for.
It is integrative. I do use the concepts and paradigms of Chinese medicine, particularly for orthopedics, the concept of longitudinal tracts or chains or continuities of myofascial tissues that we translate as the sinew meridians, the jing-jin, the sinew meridians, or the myofascial or tendinomuscular meridians. It was a very extremely useful concept, which Western medicine is now, Western physical therapy is kind of rediscovering through variously called anatomy trains or kinematic chains. That is different from the way orthopedics was practiced in the West, 30, 40 years ago, where it was very kind of cross-sectional, horizontal. We're just going to look at the elbow joint. We're going to look at the knee joint, and not how they're part of a continuity from the foot to the low back, from the hand to the shoulder. So that longitudinal meridian, if you will, approach is very useful, and I use it all the time. But I've also learned a tremendous amount from the Western orthopedic and osteopathic ways of looking at the body, and particularly my topic that I think is less commonly taught in the West is needling into joints and ligaments and joint capsules and interarticular structures. And I also do trigger point needling, myofascial needling. I use distal needling. I use ear. I use scalp. I've never found one particular approach that works best for everyone all the time.
Oh man, that is the beauty and the frustration of the medicine we practice.
And of every medical modality. I mean, if you hear a surgeon or a doctor say, this is the one best treatment for everyone all the time, run and,
yes.
Run and hang on to your wallet. Because that's not how human beings are put together. Diversity and uniqueness is the norm, and anatomy books are composite sort of middle of the bell curve approximations, but every human being, every body is a scrapbook of their life story. And we have anatomic variations, congenital variations, acquired variations. And it's impossible for any one approach to work best for all people all the time.
Right. So you mentioned tendinomuscular meridians, and I've heard other people that do orthopedic and sports acupuncture talk about these quite a bit. And the people that I know that do the trauma medicine, the hit medicine, all that, these seem to be really important meridians to pay attention to.
Yes, I would agree. And yeah.
And so I'm wondering how you like to work with them. I mean, some people like to bleed them. My wife is crazy about using gua sha.
Mm-hmm.
And I mean, I've watched her do amazing things with gua sha,
Mm-hmm.
like a jelly jar and, some oil, and it's incredible. So I'm curious to know how you like to work with the tendinomuscular meridians. And like you said, these days, Western medicine is looking at these as anatomy trains and this sort of thing. So I'd like to get your take on these things.
So I think there's really two questions there. And one is, what is the sort of, where do the jing-jin tell us to look in the body to find sources of pain or disability? And they tell us to look longitudinally, along the distributions, if you will. And then the second question, which I'll get to in a moment, is what clinical techniques do we apply? But the first question is a very important question. And what I have seen, what I went through myself as an acupuncturist and what I've seen happen in the profession is that people learn the primary meridians. We Westerners learn the primary meridians in school, focus exclusively on that. It's mistaught, in my opinion, as sort of a pipe system with a circulating goo that we manipulate through putting needles into two-dimensional points on the surface, and how that actually manipulates the goo that's flowing through the pipes is kind of mysterious. But I'm sorry, I'm being a little bit, what's the word, snarky or something.
I love it. We sometimes have a very unsatisfying way to the Western mind to describe what we do.
Yeah.
So we often think about channels and goo. I mean, we've got a fancy name. We call it chi.
Uh-huh.
But yeah, pipes and goo. I'm with you, my friend.
I think there's a lot of translational questions and linguistic questions that is probably outside of the scope of what we want to spend a lot of time on. But so I just throw it out as a question as to, and God knows on Facebook, people get into huge battles with each other over correct translations of words like qi. And let's just acknowledge there isn't a way to translate it correctly. Chinese and English are some things that just can't be expressed in one language the way they can in another language. So rather than argue over a correct translation of qi, what I find most useful, again, is the concept of spatial organization and where to look in the body to find potential sources of pain and disability, and the longitudinal orientation of the meridians and the way that that ancient classical Chinese medicine tells us to look at essentially 6 of them, not 12, the Yang Ming, the Tai Yang, and the Xiao Yang, etc., and also the depth is very important. And that's often, we think of the depths in terms of penetration of external evils, but they also tell us about the depths of fascia, the depths of muscle, the depths of structures. And those 3 Yang meridians are all superficial, the Yang Ming on the front, Xiao Yang on the side, Tai Yang on the back. And then when we go to the yin meridians, they're all internal and central, with the deepest of them, the Xiao Yin meridian, being really an axial or central meridian, right up the spine, but also kind of through the center of the limbs. And this is all verifiable in a cadaver lab. You can go into the anatomy lab and look at how these muscles, tendons, bones, and joints connect to each other along these longitudinal tracts.
Mm-hmm. So you're thinking of the 6 layers, the Liujing, as being literally deeper or more superficial in the body, not as a concept, but as an actuality.
As an actuality. And I think that's one of the, at the bottom of it, I think we have this Neoplatonic split in the West between, mind and body, or spirit and matter, that we unconsciously bring into our are mistranslations of Chinese medicine that has no such divisions. So we get that there's these, sort of theoretical meridians and invisible energies that are somehow separate from physical reality. That is a Neoplatonic and also Judeo-Christian view of the world. The Chinese view is it's all integrated, it's all interpenetratable, which I think is actually much closer to modern quantum physics. And having gone through our Neoplatonic and Judeo-Christian and Newtonian phases in the West, our flagship science of physics is actually coming full circle to a much more integrated understanding of reality that matches the original Chinese vision much better. So yes, absolutely. The six divisions or six meridians, however you want to translate it, are descriptions of tangible, physically verifiable structures that you can put your hands on, and you can also observe how they transmit forces along longitudinal pathways to make the body move or to resist outside forces to provide stability.
This episode is brought to you by Jane, the clinic management software that I use to keep my practice running smoothly. So, let's talk about something that can be a little bit uncomfortable: raising your fees. I know. This is something that might feel awkward, but it doesn't have to. With a bit of planning and care, you can handle it in a way that feels right for you and your patients. One tip: give yourself at least 2 months to prepare. This gives you time to get comfortable with the change and let your patients know what's happening. You can share the news through emails, booking reminders, or even just a friendly little sign in your clinic, and avoid over-apologizing. Instead, keep it straightforward and matter of fact. Keeping things consistent across the ways that you communicate can really help avoid confusion. Fee increases aren't always easy, but you're not on your own here. For more tips and ideas on how to communicate these changes with confidence, check out frontdesk.jane.app and look for the article, How to Tell Your Clients You're Raising Your Fees. Oh, and one last thing, if you're ready to give Jane a try, use the code CHIOLOGICAL for a 1-month grace period on your new Jane account. So there's a whole structural component to these 6 channels.
Absolutely. I think there is. And certainly, translators, there's not that many people who really look at and translate in comparison to the translators of classics of internal medicine. I'm only aware of one book, David Leggie's, that really focuses specifically on the jing-jin. Australian practitioner and translator came out with a book a few years ago. I believe the title is The Jing-jin, and his last name is spelled Legge, for those of you who want to look it up. Donald Kendall, in his work, The Tao of Chinese Medicine, has a chapter devoted to the jing-jin. And what both of them agree is that if you look at the Neijing's description of the jing-jin, it's very brief. In comparison to the descriptions of the Jingluo, the primary meridians, it seems almost, but it's very clear that they're describing specific muscles. Now, it's hard to translate some of them and figure out exactly what they mean. So Donald Kendall's schema is different from Leggie's, which is different from mine. We assign different muscles to different meridians some of the time, maybe 20 or 30% of the time we're at odds with each other. And we can go into that more detail if you want. But what we all agree upon is that we're actually describing things like the biceps, the triceps, the hamstrings, what we call the hamstrings in the West. And I don't remember the Chinese term, but it might be the fish belly. But we have our Achilles tendon. You have to know who Achilles was in order to understand that, and the Greek mythology and stuff. So the poetic language of classical Chinese leaves open a lot of room for misinterpretation, but they're very clearly describing physical, verifiable structures, not just theoretical.
Yeah. You just mentioned that you and Legge and Donald Kendall are 20 to 30% at odds with each other on your ideas. 20 to 30% at odds means you're agreeing 70 to 80% of the time.
Yeah, something like that.
That's pretty interesting. So for the folks that are listening here to our conversation, let's go a little bit into how you access these jing-jin. and work with them. And that in using them, you were talking about this longitudinal look, and I love this phrase, spatial organization. Tell us a bit about how you use spatial organization to understand what someone's problem might be and then what you would do about it.
Yeah. So to to go a little more into the how I would use that spatial organization, and then what I would do is, for example, I had a patient referred to me recently for, she's an athlete, a runner, had a medial foot arch pain. So it was a referral from a physician, and that's the diagnosis was just simply, I can't remember what the code was, but something about medial foot arch pain. So the concept of the jing-jin was very useful for me in not only finding locally what was the problem in her medial foot arch. Her first metatarsal was very loose, and the ligaments that connected to the midfoot bones were stretched out. So she was getting a whole lot of play every time she landed on her forefoot during her or pushed off from her forefoot during her running. I didn't see whether she was a heel runner or a toe runner, but either way, that joint was loose and unstable. But then I have to ask myself, why? What's going on? How did that happen? She didn't have any history of traumatic injury. What the jing-jin tell me to do is to look further along that chain. In her case, it was almost at the distal end of the chain. So I want to look at her ankle joint. I want to look at her knee joint. I want to go all the way up to her hip joint and her gluteal musculature. And along the way, I found her knee joint was stable, no problems. But her ankle joint was similarly loose, and her hip joint had a tendency to sublux anteriorly, and her external rotators were tight to, it's chicken and egg, doesn't really matter to me which came first. But she had an overall pattern of rotating her leg externally, her hip joint subluxing anteriorly, and her medial ankle joint ligaments, the deltoid ligament, also being loose and stretched out. So treating all the way along that pathway in general is going to, in my experience, work a whole lot better than just simply focusing on the foot itself by needling locally, or for that matter, if you're a fan of distal techniques and you go, medial foot arch, well, I'm going to use a balance method or master dong points or something, and look on the opposite hand and treat the tie-in meridian of the foot. I'm going to go to the tie-in meridian on the hand. Well, that works too to provide short-term pain relief, but to provide a structural change that alters her gait biomechanics, I need to look along the biomechanical pathway, and that's very well described by the jing-jin. So that's one example.
Mm-hmm. What kind of tests do you use to assess? You were just talking about ankle was loose, knee was fine, anterior subluxation of the hip joint. What kind of tests do you use to get this information?
Sure, that's a good question. In that particular example I gave you, I was talking just about joints along the pathway. So what I use is what I learned from physical therapists and actually from another acupuncturist, Alon Marcus, who is now retired, but was an encyclopedia of acupuncture orthopedics and orthopedics generally, called joint play testing, where you essentially, and that's what I'm going to be teaching a lot this weekend, is grasping one bone firmly with a hand and then grasping the other bone or other structure on the other end of that joint and moving it through both anatomical planes, the way the joint is supposed to move, but also sometimes testing it through non-anatomical directions. For example, the foot is not supposed to slide forward on your tibia and fibula. That's a non-anatomical motion. That can happen, however, it's not voluntary under our control, but if the ankle joint gets sprained, stretching out the anterior talofibular ligament that's supposed to hold the foot, on the tibia, fibula, actually this particular ligament goes from the talus to the fibula. If that ligament gets stretched out, suddenly the whole foot can slide, maybe only an eighth of an inch, a few millimeters forward on the fibula, but that's enough to disrupt biomechanics. Maybe not walking across the room, but you go for a 10K run, that's going to affect how muscles are used up and down the example of you bang your wheel into a curb, parking it, in a hurry, and then you drive across town, no big deal. But you take that same car and you drive it to Maine from California. By the time you cross the country, that little imbalance in the wheel alignment is going to result in that wheel wearing unevenly and the tire wearing out and the CV joint getting loose and, damaged, etc. So that's what happens to these seemingly small, trivial injuries or the little bit of extra joint play. Then all the muscles that cross that joint are now working overtime and don't get to rest in their normal, contraction relaxation cycles because they're having to make up for the laxity of the joint. And then they develop tendinitis and myofascial pain and strains and inflammation and degeneration and wear out. So checking the joints using that joint play testing technique is extremely important. Feeling what's the integrity of the ligaments. Is there too much play? What's the end feel? Is it a normal end feel, which is kind of a firm, elastic rebound, like it's being held in place by a very thick, taut rubber band in general? Or is it loose and mushy, like it's being held in place by stretched out silly putty or old chewing gum? Or maybe nothing at all. Maybe the ligament snapped clean through and you have kind of an empty end field. It's not a good situation. But I also use manual muscle testing, which is helpful for testing the strength and function of it's called manual muscle testing. It's really manual strength testing because the muscle has to have an intact nerve supply in order to contract. So when we're testing strength, we're simultaneously testing muscle strength and nerve supply. I'll use inspection. I watch how this patient walks. Is her leg, is right leg same as the left leg? Her right leg, no, her right leg is rotated a little externally during her gait. So all of these, pieces of information, they're just clues to put together to figure out where do I need to needle? Where do I need to do gua sha? Where do I need to do cupping? What exercises do I need to prescribe or unprescribe for her?
We've mentioned gua sha a couple times in this conversation. And I recently did an interview with a couple of women who use gua sha a lot in their practice. In fact, after doing that interview, I've started using gua sha in my clinic a lot more with, frankly, stunning results. I'm shocked at the amount of time that I practice acupuncture and not use gua sha.
Yes. I had a similar I had a similar conversion experience myself about a number of years ago.
I'd like to hear that experience. What happened, and then I want to hear about how you're using gua sha to help your patients.
Sure. Yeah, gua sha is an extremely useful and I think underused modality in the West. But what I find in general it's most useful for is breaking up adhesions and restrictions in muscles that have suffered a strain that has not healed completely. And also some structures like the IT band or thoracolumbar fascia that if they get too tight or damaged and stuff will develop basically what is scar tissue, not keloid scars that you see on the surface of the skin, but areas where the tissue organization is disrupted and has grown back in a disorganized fashion instead of the nice, neat, parallel bands of fibers that we're born with, where everything is elastic and has recoil and slides past each other smoothly. So gua sha is very useful at breaking up those tangles of collagen and elastin fibers and what we might call phlegm and blood stasis knotted together, glycoproteins that are kind of gumming up the works and preventing a muscle from contracting normally. And it radically increases blood flow through the area. And of course, one of the great insights early on from the beginning of Chinese medicine is that blood is essential for tissue healing, and that increasing perfusion through an area brings in oxygen and nutrients, carries away waste products. So gua sha is also very useful for that. So that's mostly what I use it on and I also like it because you can cover very large areas very quickly and very safely. It can be uncomfortable to the patient. If I overdo it, sure, it can cause a bruise. Only once have I broken skin accidentally, and that was on myself because I like how it feels so much, put something on Netflix and sit there and gua sha my own IT band and then look down. It's like, oops, kind of overdid it there. Yeah. But I don't do that with patients. But it's very safe. And for example, the large muscles of the back, that would take forever to find all the trigger points and needle them with, palpation of Osher points and, trigger point release techniques and so on. I could just get it all in a few minutes with a gua sha spoon and do a better job, quite frankly. Now, that's not true of all areas. I mean, again, as I was saying earlier, I feel the same way when I go backpacking or, for any other activity, it's really important to have the right gear and the right tools to deal with the specific problem of the patient before you. And even in areas like, generally I find the quadriceps work is great territory for gua sha, large muscles that you can really dig into and cover a lot of area. But for some people, it's just too painful or it just doesn't work as well. So they're like, okay, well, let's get the cups and put them on and have them, flex and extend their knee with the cups on their quad. Oh, that worked better for them. Oh, that person has one specific trigger point that's really hanging everything up and just isn't going away with gua sha. I'm going to dig in there with a needle and get that muscle to twitch until that trigger point releases. This person, I can't find really anything physically verifiable. They're a good candidate for distal acupuncture and scalp and ear acupuncture.
I'm thinking about my shop teacher in the 8th grade. He'd always say, "Right tool for the right job, boys."
You got it. Yep. Yeah. And I find that myself all the time.
Yeah. What kind of cups do you like to use?
I use the vacuum pump cups for a couple of reasons. When I was an intern at school, I had a glass cup pop off a patient full of blood, fall on the floor and shatter. When doing fire cupping, last time I fire cupped, a piece of burning cotton ball fell off the cotton ball in the hemostat onto some other cotton balls that were there to catch blood. Table paper went up in a blaze. It was nearly a career-ending disaster.
Oh my goodness!
Yeah, I am done with fire cupping. I do not like. Sure, you can get it right 99.99% of the time. All it takes is one accident, and you're done. So, vacuum pump cups don't have that problem, and it's easy to cover a large area very fast. I can put a whole row of cups up the paraspinals on either side of a patient's body. On either side of a patient's spine in a minute. And I can also calibrate the degree of suction much more precisely to their tolerance. I can pump it up a lot stronger than is generally possible to do with 70% isopropyl rubbing alcohol. And here's the real kicker, is that the patient can then move their own body with the cups in place. And if the cups pop off, no big deal. I just put them back on. But that's a technique that I actually learned from my physical therapist, who learned it from an acupuncture physical therapist combination. They call it myofascial decompression technique. I call it active suction cupping. I don't think there's anything different how I do it than what they do. But it's essentially, the genius of it is that by getting the patient to actively engage their own muscles with the cups there, overriding the sensation that they normally have that tells them not to use that muscle. Now, we're not talking about if a muscle is torn or, the first 72 hours. No, this is way too, this too disruptive a technique. I'm talking about where the patient is getting basically false information from their nervous system telling him not to use a muscle that actually needs to be used, needs to be stretched out, needs to be worked, needs to have blood pumped through it in order to recover. And that's where this active cupping technique is very useful. I can put the cups on there. The patient can flex and extend their spine, rotate, twist their spine around, and it increases both the stretch effect and the blood flow, and breaks the pain inhibition and fear and avoidance inhibition of using those muscles. The patient go, oh, I can actually move. I can actually do this. You pop the cups off, almost invariably they feel much better, like right away. And the first time a physical therapist did it to me, I had 20 years of back pain ever since the soccer injury I mentioned earlier that had never really responded well to acupuncture, to anything else. Gua sha gave me some temporary relief. This, like 6 sessions of this, is basically gone.
Imagine this. A patient walks into your clinic. They're carrying more than the pain in their body. There's a story there. A history woven with the stress of long days, the ache of things unsaid, and the quiet longing for something to shift. You listen, not just with your ears, but with your hands, your intuition, your heart. It's not just about needles or a formula. It's about connection, understanding the threads that tie us together, mind, body, and spirit. That is where golden flower Chinese herbs comes in. Rooted in tradition and crafted with care, their formulas are more than herbs. They're a bridge between ancient wisdom and modern practice. Every bottle, a quiet partner in your work, helping you to meet your patients where they are. Because healing isn't just about treating symptoms. It's about creating trust, cultivating belonging, and helping someone feel truly seen. Golden Flower Chinese Herbs, your partner in practice and connection, where tradition meets care. Yeah. So with this active cupping, it's not like a distal thing. You're putting the cups right on the area that's having trouble. And while those cups are on, you're having them move and stretch and rotate and use that muscle. Is part of what's happening here that you've got the suction, you're decompressing the tissue, which is, always helpful. But at the same time, you're adding movement in. Does this like supercharge the ability to break up adhesions and break up blood stasis?
Yes, it does. I believe so. Now, there's an analogous technique is something that's very popular in the physical therapy world right now, and massage therapy world. Active release technique, where you fix a trigger point with your thumb or your elbows, and then you have the patient contract and relax the muscle while you're putting pressure in there. So that's just more effective than simply just putting the pressure in, or simply having the patient just use the muscle, because you're much more radically breaking up the kind of pathologic cross-linking of tendinomuscular fibers that develops after an injury, where in addition to the normal parallel organization of fibers, you've got all these elastin and collagen and other fibers it's mostly collagen, that are crossing the muscle. And by using the muscle while grinding through those fibers, it's very uncomfortable, but it breaks them up because it pulls on them in both longitudinally and horizontally.
Are you familiar with this stuff called voodoo floss?
No, that's not a familiar term to me.
Oh, okay. It's something that a friend of mine turned me on to. He's a body worker, a Pilates guy. He actually lives in Taiwan. He does some interesting bodywork stuff. It's called voodoo floss, which is a great name. And it's basically like taking the tire of an inner tube and like slicing it open. So you've got a big band of this elastic material, and you put it on the joint. This wouldn't be good for lower back, but you put it on a joint, or mostly joints, or a muscle area, but mostly joints. And you wrap that stuff on there really tight. It's like a tourniquet. And then you have the person take their joint through their usual range of movement. And because it's got all this compression from the outside, it seems to really force the muscle to break adhesions up.
Interesting.
Yeah. When I hear you talk about this cupping, the way that you're doing it, I'm thinking, this sounds a little bit like that voodoo floss stuff.
Well, I could see that having a similar effect, and now you got me curious, and now I want to try it.
Yeah, well, you can just go Google it. Voodoo floss.
Okay, yeah. Thank you. I'll check it out.
Yeah, check it out. I'd like to get your opinion on that.
Now, what it made me also is what is the topic for the class that I'm going to teach at the conference is using needles into joints to stabilize them, to tighten up the ligaments that have become lax or stretched out after a sprain or surgery, for that matter, that didn't heal properly. And with that joint more stable, the muscles that cross it will heal better, will function better, because they're getting to contract with more force and then relax more completely than happens with muscles that cross a joint that is loose and unstable, where you're getting pain inhibition preventing a full contraction, and yet the muscle also never gets to relax completely because it's always got to stay somewhat turned on to compensate for the instability of the joint. So what's I think has in common with the voodoo floss that you're talking about is and Chinese medicine tells us too, right? The joints, the 9 pearls, our Hussey points, the joints are all these confluence of really important structures. They're what allow our body to move through space, and treating the joints is very important for the functioning of the muscles that cross it, and for the stability and the mobility of the body. So
when you are working to stabilize the joints, I suspect you first using your particular diagnostics, found the joint's a bit loose. It sounds like you would go up or down that particular longitudinal train of what's connected. But it sounds like you're also going deeply into the joints.
Yes, that's right. Yeah. And that's something that I learned from Alon Marcus, who I mentioned earlier. And what he really did for me was, well, again, a lot of our inspiration comes out of our own personal experiences. I was taking a class from him, and we got to the section on, lumbosacral pain, and he used me as a demonstration model, needled into after doing some mobilization of it. And when I stood up on the table, I felt like a different person. I mean, everything head to toe was lined up in a way that felt much more comfortable, took much less effort. My posture was better, everything. I was like, and it lasted for, I don't remember exactly, a week or so before it began to fade. But, that's pretty good for one or two needles to produce that profound effect, and clearly with some repetition, it had a more lasting effect. What came out of that for me was return to studying anatomy books. And that's what he really did for me as a teacher, is kind of kick open the door and say, go study your anatomy again and learn to use your needle as a probe and a tool for treating anatomical structures. And so I just started spending a lot of time looking at skeleton models, looking at my netters on my lunch breaks, and studying other, resources of anatomy to really understand all the things you can do with a needle if you know your anatomy.
Can you give us an example?
Well, yeah. So no one ever taught me how to needle the radiocapitellar joint in the elbow. That's the joint that, that joins the radius to the humerus. It's this kind of curious circular joint that allows the for pronation and supination in the elbow. But having been taught by Alon this technique of testing the joint's integrity through passive, joint plate testing, and then if you find a plane in which it is loose and the ligaments, it's got too much motion and the end feel is kind of soft and mushy rather than firm, needling into those ligaments to tighten it back up. So I had a patient who, she had she's actually a student of mine, had a freak injury where she was reaching into her washing machine or to her dryer, and there was a short that suddenly wrenched her elbow. And, she came into my clinic the next day and her arm was going numb from the elbow on down. I was like, oh, this is not good. This could be a serious, limb-threatening injury where, nerve and blood supply are getting damaged. Referred her to an orthopedist who basically said, here's a sling, come back in a month if it's not better. That was a disappointing referral. It didn't come the way I wanted because I was afraid she would need surgery. But so I'm like, okay, well, let's do what we can here. And on stress testing, I found her radiocapitellar joint was really loose. It had gotten wrenched out of place. And so she was getting this kind of transient compression of the nerves and blood vessels. So I'm like, we need to stabilize this joint right away. If the orthopedist's not going to do it, I'm going to do my best here. I pull out my anatomy book and just look at the joint really carefully. Now, this is not a commonly sprained joint. It's probably one of the most stable joints in the body, but so I'd never done it before. But I'm like, let's look at the anatomy, see where those ligaments should be, and then find the joint. And then, without going into too much detail about the technique, which is hard to describe in audio, basically going through lung 5, large intestine 11, having to reposition the arm a couple times to account for the pronation, supination, I was able to needle into those ligaments really deeply, and it ached and was uncomfortable for her, but we could test it immediately afterwards. And it's like, oh, it's restabilized. Okay, good prognosis. Those ligaments are not snapped through. They're just stretched out, and there's an immediate feedback response. You can test it, take the needle out, instantly test it again, and did you get it or not? Did it restabilize or not? Yep, restabilized. She comes in a couple of days later, the numbness is almost gone.
Wow. So there's a couple things that come to mind for me here. The first is, so often people come in, they complain of something being tight, right? It's painful, it's tight. So often we're looking to deal with things that are tight, but, Chinese medicine, we could have excess, we could have deficiency, right? So looseness can bring its own troubles along with it. For me, that's a real take home. That makes a lot of sense. And then to correct that, and it sounds like you can correct it pretty quickly by needling into the ligament. Now you've got to know your anatomy. Are you going with you got an image in your mind. Yeah, this is how it looks. Are you palpating like with one hand to see what you're feeling? Are you feeling through the needle? How do you know that you're getting that ligament?
Sure, that's an excellent question. All of the above. Basically, I've simultaneously got my anatomy book there. I'm checking that. I'm feeling for the joint line with my fingers, and that's a skill. But with a little practice, just like feeling a pulse, you'll get very sensitive at feeling joint lines and feeling the integrity of the ligaments that span them. I'm doing my passive joint infield testing. That's really the key. And then I'm also feeling with the tip of the needle. And with just like pulse taking or with any other needle technique, with practice and repetition, you'll get to feel the difference at the end of the needle between a healthy ligament, which is like needling into a taut, thick, firm rubber band, and needling into a degenerated or stretched out ligament, which feels like you're needling into old glue or chewing gum, kind of sticky, but it's also kind of soft and mushy, and it doesn't have the firmness and the elasticity. It's kind of gummy. So all of the above. But I want to go back to, you got it. That is the essential insight, and that is, I think, often missing from both in the world of physical therapy, because they don't really have any joint stabilization techniques, and from acupuncture orthopedics, is what Chinese medicine tells us: yin yang. The muscles are yang, the ligaments and joint capsules are yin. If you only treat one aspect of that, you have an incomplete treatment. If you treat both, and you recognize the deficiency in the ligaments, the structure, the deficiency in the stability creates a compensatory excess and hypertonicity in the muscles across that joint that have to constantly work to keep that joint stable. And so you can treat the excess all the time and not really, get partial results. But a lot of times it'll just kind of keep coming back. And all of my treatments started being much more effective, whether it's rotator cuff tendonitis or Achilles tendonitis or quad strain or something, when I started looking at the joint that those muscles or tendons cross and going, this joint is unstable. We treat the joint, then all of my muscular treatments work much better and have lasting results.
Yeah, that, as we're having this conversation, I'm thinking, well, that makes sense, because you can work all day, and you can work many days in a row if you want on what, let's just call it the branch aspect. Mm-hmm. But if you're not getting down to the root, it's hard to correct the branch.
Yeah. And then to keep my own discussion of this balanced, I want to say that the muscles across the joint are also very important. And so I'm not saying, all you got to do is treat the joint, because the muscles provide dynamic stability, and sometimes it's very common, for example, in the shoulder joint. The ligaments in the anterior shoulder can get stretched out and loose, not because of a traumatic shoulder dislocation, but simply because of poor postural and biomechanical faults, and then the rotator cuff starts to degrade. Well, the rotator cuff tendons blend into the front of the capsule, and that's what cadaver labs really teach me, is that all of these distinctions are linguistic and somewhat artificial, because, as Chinese medicine tells us, everything is interconnected and interpenetrating and contiguous. So if I'm going to treat a shoulder rotator cuff problem, I need to treat the joint if it's stretched out, but I also need to treat those rotator cuff muscles and tendons so that they provide the dynamic stability, and their contiguous relationship with the joint is treated.
Love it. It's got me thinking about all kinds of ways of going back into my clinic and taking another look.
Yes. That's the fun of it. For me, it's sort of like, again, to use the backpacking analogy a little bit, I've hiked this trail using this map many times. Now I'm going to go off trail. I'm going to go cross country, and I'm just going to feel what my feet find and look around what my eyes see, and use the map in a whole different way. Instead of just telling me where the trail is, I'm going to palpate. I'm going to test joints. I'm going to, look around and pull out my anatomy book all over again. And that just keeps everything fresh and exciting and alive. And to me, it's just a much more exciting way to practice than simply going through protocols over and over again, which is kind of like walking the same trail back and forth.
If I had to do protocols day in and day out, I'd be looking for a different job.
Me too. Yeah. It would have gotten boring, within the first year or two out of school.
Right.
and unsatisfying because the results are only partial and incomplete a lot of the time if you just sort of stick to a protocol and don't feel and look and see what's going on and listen.
Yeah.
You can also hear joint problems.
Hear them, see them. I mean, I like what you were saying earlier, that you just look at how people move and let that also speak to you. I guess that takes some practice to really learn that, doesn't it?
Yeah, it does take practice. And pulse and tongue, everything takes practice and everything takes repetition. And this approach isn't for everyone. And some people are just, learn through different, as you said, some people are, visual or auditory learners, and they'll listen to the patient's voice and how they talk and then treat their emotions. And that's also important for orthopedics and biomechanics, because a lot of this stuff does have emotional dimensions to it. The patient has poor posture because they're depressed and they slump and slouch, or they're tight because they're angry, and et cetera. But we're all blind men feeling different parts of the elephant and trying to put it all together. And
yeah, well, I appreciate you taking some time to share your portion of the elephant with us here today.
You're very welcome. My pleasure.
Well, I think we need to get back to the conference here. Anthony, are there any final thoughts that you'd like to leave the listeners with?
Yeah, just don't be scared of a needle. Have courage that you can apply needles very safely. Yes, you need to know where major neurovascular bundles are. In sports medicine, we're rarely treating over the abdomen, but we need to know where our internal organs are. But we can needle much deeper, much more strongly, and use much thicker needles very safely and do a lot of good and help patients if we know our anatomy. And knowing our anatomy, spending time in cadaver labs I prefer 3D and palpable. Take a class from a body worker who teaches surface anatomy. There's some great instructors in the bodywork field about really identifying your muscles and your joints and your ligaments. And then there's online resources and books too and stuff. But the more you know your anatomy, not just on the surface, but all the way through, you can practice with greater safety and greater results. And I find it much more fun and exciting and alive and satisfying. So
that sounds like good advice. It's always good to know more about the stuff that we need to know about. Well, here we are at the end of this episode. If you've listened up to this point, you're either a rabid fan of Qiological or the forward button on your podcast player stopped working. If you are indeed a fan of the podcast, you can help us to bring new episodes to our community of practitioners by supporting us with a membership or a one-time contribution. Details, of course, are on the website. That's it for today, friends. Join us again next Tuesday for another thoughtful episode of Qiological.